Hello, my name is Mariam Manukian, and today I will be discussing type 1 diabetes. I would like to start off with a quick fact about diabetes. Ancient Indian physicians from 1500 BC originally called diabetes madhumaha, which meant honey urine. Due to the high levels of glucose in the urine of diabetic patients, bugs such as ants were attracted to the sugar in the urine. In this image, we are looking at a stained slide of a human adult pancreatic islet. An islet contains alpha cells which produce glucagon and beta cells which produce insulin. These two components are responsible for regulating blood sugar and ensuring that sugar can be utilized by the cell as energy. In this image, insulin is stained in red, glucagon is shown in green, and the blue color indicates the nuclei of alpha and beta cells. In individuals with diabetes type 1, beta cells do not produce insulin. There are three common types of diabetes mellitus. Type 2 diabetes is a chronic condition that directly affects how the body processes glucose. This condition can emerge when an individual is overweight or if they have PCOS. Gestational diabetes is a form of high blood sugar that occurs with pregnant women. Once the baby is born, however, this type of diabetes tends to go away. Type 1 diabetes is caused by an autoimmune response where the body attacks the beta cells that are responsible for making insulin. Unfortunately, the cause of type 1 diabetes is unknown. Also, type 1 diabetes is less common than type 2. Insulin is an important hormone which cells need in order to take sugar from the external environment and bring it back into the cell. In this image, we can see a comparative diagram of normal blood glucose versus high blood glucose levels. Cells are not able to get the sugar needed to make energy. If the sugar remains outside of the cell, the body will eliminate it through urine. However, there are many issues that arise from excess sugar in the bloodstream. Hyperglycemia, also known as high blood sugar levels, can lead to a variety of issues if the condition remains untreated. Sugar can damage the vessels that supply blood to vital organs, cause nerve damage, increase the risk of stroke, heart disease, kidney disease, and vision problems. Although there isn't one specific cause for type 1 diabetes, some of the risk factors include family history and age. If you have a parent or a sibling with type 1 diabetes, you have a higher chance of also being diagnosed. In addition, you can get type 1 diabetes at any age, although it's more likely to develop during childhood, teenage years, or as a young adult. There are a couple of ways to diagnose type 1 diabetes. First, a A1C test is a blood test that shows an individual's average blood sugar level for the past 2 to 3 months. The greater the blood sugar levels are, the more hemoglobin they'll have with sugar attached to it. If the A1C level is 6.5% or higher on 2 separate tests, then the individual will be diagnosed with diabetes. Doctors can also order a fasting blood sugar test. A blood sample is collected after a patient fasts overnight. If its levels are 126 mg per dl or higher on 2 separate tests, the individual has diabetes. Per the CDC, increased urination, extreme thirst, low energy, and weight loss without trying are the most common symptoms of type 1 diabetes. Unfortunately, there is no cure or treatment for the disease. The most important thing one can do is to make sure blood sugar levels are within a normal range. Individuals should eat several small meals throughout the day rather than 3 large meals. For type 1 diabetic patients, the primary mechanism for regulating blood is through insulin injections. Finger pricking is done frequently in order to monitor blood sugar via a glucose monitoring device. When blood sugar levels are high, insulin is administered through an injection. A subcutaneous insulin pump can monitor blood sugar and administer insulin regularly. It is important to make sure that blood sugar does not dip too low, since that can result in hypoglycemia, also known as low blood sugar. Hypoglycemia can lead to coma if left untreated. Adjusting to living with diabetes can be difficult for both parents and children. However, it can be managed through balanced meals, normal blood sugar levels, and physical activity. Thank you for listening to my presentation, and I hope you enjoyed it.